Good evening. Thanks for coming here on short notice tonight. We appreciate that. As we know from the governor's office today, we have confirmed novel coronavirus, more commonly known as COVID-19 in South Dakota. I just had a chance to talk with the governor before this press conference to get an update from her on the press conference today and the key messages that she would like to be sure we continue to get out here in Sioux Falls. We know a lot of people in our community now are wondering, now that it's in South Dakota, what happens? What's next? And so we have some of our community partners here to talk about that today. As an example, our health department here in the city has been working on and planning with community partners, Avera, Sanford, the state, others to be able to support a community coordinated wide response. We have a great team of experts and professionals who are keeping up with updates from the federal and state government on a daily basis. In fact, tomorrow, I personally am on a conference call with the White House with several other mayors from around the country just to get a briefing from them on this. So the communication flow has been really good, been really great with the state, who is again leading this effort. And so just want to ensure that the community knows that we got good partners in place. We have a strong response plan for COVID-19 that we've been working on for not only weeks for this, but this is what our health partners do. This is what our State Department of Health is set up to do. So with that, I'm going to turn it over to Jill Franken. Jill's our Director of Health for Falls Community Health here in the city, and she's going to share some updates from the city standpoint.
Thanks, Mayor Tenig. And again, I'm Jill Franken, Director of the Sioux Falls Health Department. Public health, our goal has been all along on the rapid identification of cases of COVID-19, whether it be in our community, the state, or the country, as well as to decrease potential transmission of the illness. That is the role of public health. Our local health department preparedness efforts for this response actually began as far back as January. Activities include maintaining situational awareness, of communicating and coordinating with community partners in our area, as well as with the South Dakota Department of Health. So we have established a COVID-19 planning team here in our community to conduct the work of community planning, of preparing, of monitoring, and of providing communications. We have reviewed our pandemic influenza response efforts from 2009 and 10, which actually are very applicable here, even though this is coronavirus and not influenza as a novel virus. And we have actually hosted a number of meetings with the city, with community response agencies to discuss planning efforts and the implementation of the non-pharmaceutical interventions, of which have been shared widely in recent weeks. We've been coordinating regular calls or participating in regular calls with the Department of Health to help in facilitating timely information sharing as well as response coordination. We're here to assist them with whatever they need to help in our community specifically. With no vaccine available to prevent this illness, we continue to stress the importance of community mitigation efforts, things like social distancing, good hygiene, and environmental cleaning. We especially urge those who are in the higher risk categories to be paying close attention to ways that they can prevent becoming ill with this virus. The South Dakota Department of Health is the lead agency for this coronavirus outbreak. They will conduct all testing for the virus that causes COVID-19 and are in charge of all disease investigation. We, as a local health department, will continue to work with them and support requests that they have for assistance from our department. The South Dakota Department of Health has set up a call center, 800-997-2880, as well as information at covid.sd.gov. I want to stress, lastly, before I turn it over to the Sanford and Avera folks, that we should not panic. As a community, we must be focused on the common sense measures to reduce the spread of disease. And with that, I'll turn it over.
Thanks. Good evening. My name's Allison Suttle. I'm the Chief Medical Officer at Sanford Health. And I just wanted to talk a little today about the prevention of this illness. now that it is here within our communities or here in the state of South Dakota, even on a small scale, there are different things that you might want to do to be prepared and have a personal plan and a family plan to how to prevent this illness from spreading. It's not only preventing it from you yourself getting the illness, but preventing it from other people in the community getting the illness. We have to think about our neighbors and about each other. The more we do that, the slower the spread of the illness and the more likely that we won't have as many cases if we're all a little smarter about doing different things. So first and foremost, it's going to be washing your hands. Soap and water is the absolute best thing to do. Do a 20-minute hand wash with soap and water. Sing the ABCs. It takes about 20 seconds and you're good to go. Hand sanitizer can also be very good too, but soap and water is really the best thing to use. Wash your hands often. The droplets from the virus, from another person that's infected with the virus, you can get from surfaces, so just wash your hands whenever you can. Social distancing was also mentioned, and I just want to talk and answer what is social distancing and what does that mean? Really what it means is you might want to consider avoiding large crowds, big crowds of individuals where you could be exposed to surfaces and other individuals that are sick, especially if you have those chronic conditions, multiple chronic conditions, or if you're older, just because you're more susceptible to the disease. So really kind of thinking about, if church is broadcasted as opposed to going in person, maybe eating in a little bit more instead of going out, or being in large crowds at movie theaters, things like that. Not that you have to avoid them altogether, but just kind of think about what are the things that you really want to do and what are the things that you might not do as much of. And just make sure you bring the hand sanitizer and wash your hands when you do that. As Mayor Tenhaken said, we do this every day. This is what your health system is designed to do. We prepare for this stuff. We've been preparing for it since before H1N1, before Ebola, before this. We are constantly preparing, planning, practicing for just these things. So we are as ready as we'll ever be. And as he also said, definitely call first. It's always better to call first. That way we know you're coming, or we can potentially treat you over the phone. And that way, again, we avoid spreading things to our colleagues. So it's definitely a time to look out for your neighbors, look out for each other, which I know we definitely do here in Sioux Falls. So thank you.
Good evening, I'm Dr. David Erickson, Chief Medical Officer with Avera Health. Avera and Sanford Health confirm, as Governor Kristi Noem has announced, South Dakota's first presumptive cases of COVID-19 in South Dakota. These cases were all travel related. Both health systems are working in concert with the South Dakota Department of Health and are taking steps recommended by the CDC to protect employees, patients, and visitors. These include protective gear for staff and isolation of patients when COVID-19 is suspected. It's important for the public to understand that COVID-19 cases range from very mild, including some with no reported symptoms, to severe, and there are cases that have resulted in death. Typical symptoms of COVID-19 are fever, temperature over 100.4, cough, and shortness of breath. Anyone who's experiencing difficulty breathing or an extremely high temperature should call their healthcare facility. Not everyone who's exposed to this virus will experience serious or life-threatening illness. In fact, the majority are mild. Older people or people of all ages with underlying health conditions such as heart disease, lung disease, diabetes seem to be at a higher risk of developing serious illness. Not everyone who develops symptoms of COVID-19 will need to be hospitalized. Approximately 80% of patients who have COVID-19 can be treated at home, and that's an important fact. Let me repeat that. 80% of patients who have COVID-19 can be treated at home. The rate of patients who experience serious complications is slightly higher than the seasonal flu. And if you feel you might have COVID-19, please call your regular clinic. The most important message you've heard from the mayor and my colleagues at Sanford is please call. Do not come in unannounced, because the risk is you will potentially spread this to staff and other patients. So very important, please call. So thank you, and I'm going to turn it back over to the mayor.
All right, so I'll invite my colleagues back up here. We can take any questions. I think the closing statement for me is two things to remember. Please go to covid.sd.gov. If you have you need information on this, that's the central point that we want to send people to. Not the healthcare system's websites. They're great, but if you want to know the most up-to-date current information on this, covid.sd.gov. And secondly, the state has stood up an 800 number hotline for any questions about COVID-19. 800-997-2880. Right? That's a very important number. Keep that for any questions you have. So with that, questions for myself or any of our colleagues here, we sure answer those. Dan.
To what degree should people practice social distancing, would you say?
You know, we talked about this a little bit, and you know, there's a cautious level of being socially distant from normal activities and hitting a panic button. So if there's activities you can do that you can just avoid, Dr. Suttle used the example of going to church. If you could stay home from church, stream that, do that. If there's an activity you were maybe going to go to and now feel like it's something you can miss and just stay home, do that. We're not asking people to hit the panic button and lock themselves in the house, but social distancing is a good practice. So for me personally, that may look like staying home with my kids tonight instead of maybe going out for pizza, things like that.
How do you see this affecting local events in the area with the St. Patrick's Day parade coming up and things like that?
Yeah, that's some things that we'll continue to look at. Is are there some of those events that maybe we should look at canceling or look at avoiding? St. Patty's Day parade is one of those events where if I was a consumer, they have the choice. If they feel comfortable going out to that event, assuming we'd still have it, they can make that choice. But per Dr. Suttle's recommendation, it might be an event just to maybe stay home from. The world will still go on if you're not at the St. Patty's Day parade, so that's probably a good litmus test to use for events like that. But we're going to be looking at that to determine are there events that the city controls that we have to look at maybe putting brakes on.
I can just add, certainly those outdoor events are less risky than being inside in a confined space. And it's getting warmer, so we are not sure if that impacts, but certainly being warmer, being outdoors, less cramped is a good thing.
Todd?
There's going to be some big basketball tournaments here in West River. Any thoughts on whether they should go on or whether they should go on without crowds?
The one thing I'd advise is the high-risk group. So if you're in your 6th, 7th, or 8th decade of life, or if you have chronic medical conditions, certainly diabetes, lung disease, those are the folks who are at most risk for this disease. So if you're in that age group or have chronic medical conditions, I think that's an individual personal decision. Call your physician, talk to your family. But those are clearly some facts we can share, whether the event goes on or not. I think those at high risk need to take all that into consideration.
I would also say that if you are sick at all, absolutely stay home. I think we've shared that a number of times, but that can't be stressed enough, that if you are not well, you should be staying home, and then you should be contacting your provider for further information and guidance.
And for anyone who does have COVID-19 and has to be treated at a hospital, is there a certain hospital? We heard that maybe Sanford was going to be the ones to treat it and Era wasn't. Or is it just any?
Yeah, no, I think we're already, it's not like Ebola, which was much more contagious and much more fatal, much more significant or worrisome. So I think any health system would be able to take care of a patient. It's the standard equipment that we would wear, the protective equipment that we would wear. But yeah, we'd both be ready.
I agree.
To the health systems, I know specifically Sanford has a number of residential nursing homes, inpatient facilities, and I know Vera does as well. After what happened in Washington, a majority of the deaths in this country were at nursing home. Can you talk a little bit about what steps you're taking across the board?
Yeah, so lots of conversations around that. In fact, the ACA, which is the, I'm gonna miss the vernacular here, it's like the American Hospital Association for Long-Term Care Facilities. They came out with a statement recommending that there not be any unnecessary visitors in long-term care facilities. So specifically those long-term care facilities and assisted living facilities. So we have, for all of our Good Samaritan sites across the country, in addition to our Sanford long-term care facilities, are instituting having one location where people can come in and out of those long-term care facilities, that there's someone there to screen those that do come in for travel and for symptoms, and that we really are going to say for family members to try to stay at home unless there's something critical that you need to come and visit family members, to really kind of think about, again, you know, for a younger, healthier individual, the chances of getting the virus are certainly there, but getting terribly sick is not. So you'll just have kind of cold-like symptoms, just like Dr. Erickson said. So it won't be very severe. So if you don't feel very ill and you go visit your 80-year-old mother, you're kind of carrying that virus into that facility. And so we really are significantly limiting visitors to our long-term care facilities.
And the only thing I would add is we're following the CDC guidelines just like you articulated, and certainly want to put in a virtual technology so you make sure that you can connect with your loved ones, iPhone, iPad, that type of thing, so that you can still see them and connect with them, but certainly looking at instituting, limiting the amount of visitors. You know, maybe they can select one member per family to help carry that message forward. But yes, I think we're all very mindful of the events around the country and what unfolded out in Washington State. We want to learn from that. And, you know, they are our most vulnerable patients, and those are the ones we really need to protect. So I think that's a great question.
Jill, if Sioux Falls becomes a hot spot, is there like multiple or many cases of coronavirus? Is there a plan of quarantining or otherwise housing people that need to be away from everyone else for a while? Because I think one of the cities in Washington bought a hotel to put people up.
Certainly, if we are needing to consider that there are large groups of individuals that, whether it's needing to be isolated at home or whether it is that they are in a situation where they need to be quarantined, we would work with the State Department of Health to assist in identifying that they have a proper place to do that. There's a difference between if you're quarantined because you've been exposed but you're not sick versus being isolated because you are sick. And so we would work with them to help assist in the case finding and then helping to make the proper recommendations for those individuals. Many people can be well served just staying at home and being in another room by themselves and being very careful how they're coming into contact with their family members. But they don't necessarily need to go to a different place to stay if they're quarantined or if they're mildly ill. And those who are severely ill would be cared for in a hospital setting.
All right. If no other questions, you can socially distance yourself from council meeting tonight. You don't have to come. And we do have that in 45 minutes if you want to be there. So.
I have a quick question.
Yeah.
With the level of panic kind of ticking up a little bit in the city, as far as like cleaning supplies, toilet paper, water, is there a statement that any of you could give to kind of calm people a little bit?
You know, we put out a statement earlier this week about surgical masks, for instance, and the strain was putting on, you know, healthcare partners who actually need them to do patient care, and the strain on some of those resources. So we're not at the point where you have to go out and buy a pickup full of toilet paper, bottled water, and mac and cheese. I mean, so I just want to tell people to de-escalate that. That's a little bit of a panic button approach right now. We're not near there yet, and so I think that's a little bit of the hysteria that we've seen, that we're just trying to tell people, get your normal supplies, live your normal life, but with caution, with using the recommendations that the healthcare professionals have recommended today.
The only thing I would add is the concept of if an individual stockpiles all the stuff and they take it to their own home, then it's not available for everybody else who might need it. And there's only a certain amount of supplies that can be produced at any given point, and the whole supply chain works when we all take only what we need, and that way there's enough for our neighbors. So it really is an opportunity for us to say, what do I need today based on what I know about the situation? So stick to the website, covid.st.gov, stick to sources of truth where you can get the right information, then they can tell you things are escalating, now this is what you need. But when you stockpile all the hand sanitizer, then there isn't hand sanitizer for those that are more ill or more sick. So we all need to kind of do this together.
But what can you do for stores that just want to sell it to make a profit instead of, there's not much you could do, is there? Because if you do 10 per 5, or 5 or 10, I mean.
Well, that's capitalism, you know, and that's opportunists. So there's opportunists right now, and we're seeing that a little bit in the market where there's elevated prices online for certain things. Someone told me about and I don't know why this would be the case, but some Tamiflu on eBay, which was going for incredible prices. So that's just people trying to make a buck off the hysteria. So consumers just need to be smart with this, just like any other consumer purchase. So.
And Mayor, you said you had some contact with the White House and the federal government about all this. What are they telling you, and
Well,
are you happy with their response?
Yeah, we have a call tomorrow with the White House Intergovernmental Affairs Office with some of the mayors of larger municipalities around the country. So, but they're not going to tell us anything that we already don't know and feel confident from the state. So, you know, again, the state is leading on this. We're taking a lot of our cues from the State Department of Health, who in turn is taking theirs from the CDC and the White House. So there's really a chain of command and of communication that's happening right now. So we'll have that call tomorrow, but I expect it to be much of the same messaging we've been hearing already.
And I would just share our experience with the White House with our long-term care facilities. Randy Bury, our president of Good Samaritan Society, met with Vice President Pence and Seema Verna, and was able to share some of our concerns with staffing and bringing nurses across state lines and licensure issues. They were very receptive to learning. So I think you'll find that they want to know what's going on. We're all in this together. What can we do to help? What regulations or barriers are up that might make sense in another time, but right now we need to kind of take care of so that we can do what we need to take care of our communities.
Mayor, this wasn't the big surprise you were talking about for tomorrow, was it?
Tomorrow's fun news. This isn't super fun, but tomorrow will be fun. So 1 o'clock. Be there.
Be there, aloha.
We've got one more question on live about addressing upcoming international travel plans. If somebody would touch on that.
I would encourage that person to go to cdc.gov for the latest update on travel advisories. They update that regularly with the latest information.
All right, thanks everybody. Appreciate it.
Thank you.